paper published at the end of 2025, and it's from Dr. Monica Arroyo, who is on our medical advisory board. And she and I spoke actually at the National Association of Neonatal Therapies conference in 2022, in that early, I think it was March 2022 that we spoke. And a lot of the discussion that spurred this work was from neonatal therapists that said that they didn't have access to work with HIE babies until well after cooling, and that they were frustrated that there were no standards and guidelines about developmental care during therapeutic hypothermia, that a lot of times they wouldn't even get the referrals sent to them until after cooling, and they're missing key windows of working with families on developmental care. And when we talk about things improving trauma-informed care, family-centered care, bonding, things like this during cooling, holding during cooling, feeding during cooling, and looking at what babies should be and can be included in that to improve bonding, decrease the impact of trauma. This was a big sticking point that came out of those conversations at that conference. And so Dr. Arroyo and one of the lead speech language pathologists, Dr. Rocky Garcia, they collaborated to look at a dual survey that would go to neonatal therapists and to HIE parents to see what their perspectives are of the neonatal therapy services that they received during their admission. So one survey to the providers was disseminated into the National Association of Neonatal Therapists, and then the parent-facing one was disseminated through our community in October 2022. So the results were 63 parents participated in this, and you had to be a parent to a child that was between 6 months and 24 months old. We wanted it fresh in people's minds of what they remembered and what their perspectives were of neonatal therapy services. So you can see the results in conclusion. This is also on our blog. The full PDF of this is available, and it looks like this. So the key findings really of this are found in that results section. So when 70%, almost 70%, so the vast majority of parents reported that therapists first met with them after MRI. So MRI is pretty standard between days 5 and 7 for HIE babies. That means these therapists are not seeing these kids, as it was echoed in that conference, until way later. So any sort of input to improve outcomes, getting their early intervention with babies. So even hand hugs, gentle touch that doesn't impact cooling negatively is really just not there. And so most parents wanted to meet earlier. Most parents reported that therapists were not involved in care plans in the multidisciplinary team, and that was something that could be improved. So you can read more about the key takeaways and all of that on our blog, but more to come on this. I think there's so much, we talk about guidelines and things like that, and that there's so much opportunity. This area really does make a huge difference, that developmental impact and developmental care and the, family input with their own babies during the earliest stages of clinical care is just such an unmet need. And there is just, again, so much opportunity to look at how we can better care for HIE babies and families.